Thank you guys for coming. We really appreciate it. It's fun to give these little talks and have someone to talk to. And we like to post these things also online so that our patients can reference them if they want to and learn a little bit. But it's awfully hard to give a talk without an audience. So I appreciate you guys coming. I'm Dr. Morgan. And what I'd like to do is just talk a little bit about allergies. My job tonight is to talk to you more of a high-level scientific, like what's actually going on with allergies. And then we're going to have Jess come in and talk a little bit about what we can do here at Balanced Health to help train your immune system to quit fighting things. And so that's part of what's going on with allergies. If you're really at a high level, what is going on with allergies? It's your immune system. It's kind of gone haywire and it's trying to fight things that aren't fighting you. It's really interesting how this comes to be and how it happens, because one of the thoughts is that it's likely that we suffer from allergies here in clean modern countries like first worlds, because we don't have a lot of germs and parasites to fight. It's actually been studied in countries where you get parasites when you're a little kid and you're fighting off lice and you're fighting off worms, that you don't have allergies. And it's been a thought for some people is that maybe we just need to give people parasites. Nobody wants to do this, but it actually is likely true that our immune system, for lack of a better way of putting it, is just itching for a fight. And so it's trying to find something to do. And what it does is it finds, your pet dander, the seasonal pollen that, in the spring, maybe it's trees, the summer it's grasses, and in the fall or late summer, it's those late summer weeds. Maybe it's house dust, but it's looking for something. And when it doesn't find worms, it goes after the pollen or the pet dander. And so it ends up causing us a lot of aggravation and problems. The physiology behind it is we have our immune system, right? So part of our immune system involves what we call antibodies. We throw out these terms all the time without explaining what it is, but we can tune our immune system to fight pollen by creating antibodies. So antibodies, what are antibodies anyway? It's really interesting. They are Y-shaped proteins. You can think of it like if we had a Y here, that let's say it ends right here. Our Y-shaped proteins, we make different kinds. The kind that's implicated in allergies is called IgE, and it's also the same kind that we would use to fight parasites, and that's where this association comes from. But what happens with IgE or with any of these antibodies, is we can tune this side of these Y-shaped proteins to stick to germs. And what we call germs over here in an immunological sense is called antigen. And if we tune these Y-shaped proteins, they'll stick to the antigen. And then this side oftentimes can act like a beacon that will trigger the other immune cells to come over here and gobble up this germ. Well, in allergies, it's kind of turned backwards. And what we do is we tune these to fight, unfortunately, pollen. And then we've got this side stuck into a kind of cell in our body called a mast cell that's just loaded down with little packets, granules of something called histamines. And if pollen comes along and we've got these things in our nose or in our eyes and it attaches on here because we've tuned it to fight pollen, this will trigger this mast cell to release histamines. And that starts a whole cascade of events. Histamines go out and they cause vasodilation, and they're communicators of our body's immune system. And it says, come on, let's go. We got to have a fight. And so it brings a bunch of other immune system mediators to bear that ends up causing things like nerve irritation, which causes itchiness in our sneezing. It can cause leakiness of our capillaries, which may end up causing us to have watery eyes and a runny nose. It can cause vasodilation. We'll get red eyes. And then it can cause just inflammation in our body. And that might manifest itself in ways that might be surprising to you. Just fatigue. Maybe it's just joint, maybe a skin rash and itching. Sometimes we'll see people and they'll just have rashy skin. And really what the underlying problem is that their immune system is so fired up because of their allergies that unless we get control of the core problem, we're really fighting a losing battle. So what happens with medicines is those medicines are meant to stop that cascade of things that happen from the release of histamines to the inflammatory response. And if you think about the different cascade and the different things physiologically that's going on. Some medicines are meant to block maybe here, some over here. We got the antihistamines. They try to stop it here. Sometimes we'll use a nasal steroid or something called montelukast, but these are all just kind of trying to stop it after that snowball's already been pushed off the hill and creating this immune system response. And so what we would like to do is keep it from ever happening. And that's what immunotherapy is about. In times past, I would counsel people, to avoid allergy exposure, and it can kind of help temporarily. And you do things that maybe you wouldn't like to do, like stay away from that person's house with a cat, or don't go over to your grandkid's house because they got a dog, or stay inside at this certain time of year, or keep your window shut in the summertime because you don't want that pollen coming in. Well, it's nice to open up your window in the summertime, right? So those things, ironically, though they can help you that day not have an allergic reaction, the more we avoid that thing, the more likely the next time we are exposed to it, it's going to be worse. And what's weird is that our immune system, with chronic exposure to that thing over a long period of time, can learn that it's not hurting us. And that's what immunotherapy is about. So what we do with immunotherapy is we figure out exactly what you're allergic to. Jess is going to talk more about the details of this, but we find out exactly what you're allergic to. We build a concoction that is tailored for you, and you get it every week if it's shots. So you just take that shot every week, and then what ends up happening is we give you you get an escalating dose slowly every week over the course of 2 to 3 years, and then it teaches your immune system there's no need to fight this stuff. It's not fighting you, and once your immune system calms down, the effect can be enduring. It can last 30 years or more, and it just is a flat cure for allergies. It's not a medicine, doesn't have side effects. It just teaches you to stop fighting things. From a high level, when this happens, I was thinking about this, reading around, and I saw this quote. I loved it. It's like when our immune system does this, it's like, so our immune system is like, it's our guard dogs, right? It's ready to go fight. So it's like our immune system has been trained to go to keep the wolves away. Right? It's the guard dog meant to keep the wolves away. When we have allergies, we're in a suburban world, and we don't have wolves, but we have mailman. And so now the dogs are trying to keep the mailman away, and that's what the pollen and the cat dander and the dog dander is. And so I loved that quote, and I just thought it was pretty clever. It's a good explanation for what's going on. So that at a sort of a high level, without getting too deep in the weeds of physiology, is what's going on. And what the idea of immunotherapy is to teach our body to quit fighting stuff that's not fighting us. So with that being said, I'm going to turn it over to Jess, and she's going to talk a little bit about how we can do that at Balanced Health and why we brought it here. So
thank you, Dr. Morgan, very much. I love that analogy because it brings in the emotional aspect of it, because we do then we start being afraid. Like, you're not afraid of the mailman, but we start being afraid of a cat or of the pollen, and it's like, oh, get it away. And then, like you said, you limit your life and your world gets smaller and smaller, and it's stuff you shouldn't be afraid of, but it becomes the big bad wolf. So I love that analogy, because it does become something emotional, me having allergies, not being able to be around cats my whole life, and having to ask every time I go to someone's house, do you have a cat? It's just, it gets old, and it's sad. There's half of my friends, I can't go to their house, but not anymore. All right. And that's because we actually introduced this. We brought it here, and we've trained expertly our staff. So we have an allergy team here, and it's really, really exciting. So a little bit of this has already been gone over. Just to reiterate what Dr. Morgan said, the overview, same thing he just said. Your immune system is defending you against harmful substances, but it overreacts to these harmless ones, which are the allergens. And just like you said, the IgE antibodies are in response to harmless triggers. So it could be something mild, sneezing, itching, to severe, though. There are cases of anaphylaxis. And that's really scary when you have something that is life-threatening. And that, too, can be avoided And that situation can be abated through allergy treatment. And that's, to me, a really big deal, because when you have lived your whole life being so afraid, but you could have a reaction that could kill you, and then to have something that can take that fear away, that's a big deal. Okay, so again, same thing. We know what allergies are. I really didn't know this. I don't know if anyone else. That pollen, I'm like, what is pollen? Pollen, because we don't have pollen on our list of things but pollen is just that fine powder, but it can come from weeds, it can come from trees, it can come from grasses, it can come from flowers. So all of those, it's just a really fine ground up powder from any of those things. And you can be allergic to any of those things. And we just call it all pollen. So there's something interesting, though, called cross-sensitivity, and we're going to talk a little bit more about that, is when your immune system can react the same way to things in the atmosphere and in your environment as it does to certain foods. And so that will come into play in just a minute when I talk about why we test for food. Because although we can't take a shot or a drop of that little food and build up a resistance to that, we can kind of go in the back door and use the similar protein that's in the airborne environmental allergy and trick our immune system into not being afraid of that food or not overreacting to that food. We're the ones that are afraid. And there's an example there, like mugwort weed. Well, it cross-reacts with milk. So if we treat mugwort, then you have a milk allergy. We actually don't react to milk as much. Fascinating. Bermuda grass and gluten. So many people are allergic to the grasses, and almost all of the grasses cross-react with grains and gluten-containing grains specifically. So we have a couple of different methods here, which is nice. It's nice to have options. So the first option, and by the way, our master mixer and formulator is Keith Carlisle there in the back. Raise your hand, Keith. He's super, super, super smart and fast at doing this. In fact, I'm just going to have to give a shout out that when we were trained, the trainer who's trained all over the nation said that he's the fastest and most accurate person she's ever trained. So we have like the master mixer in our clinic, just so you know. But so we were trained on these two different methods, and there are a couple of differences that are important to know. There's skin prick testing, which a lot of you are probably familiar with, where you get all the little pricks. And I remember when I was about my daughter's age, 14, I had all the pricks done and all down my back. But that tests for the environmental, the respiratory, the weeds, the grasses, the trees, the cats, the dog and danders, the insects, the molds, all of those. It is less expensive. It's about $100. It is $100 for members. It's $197 if you're a non-member here. It takes only 15 to 20 minutes, so it's nice and convenient. You're sitting there, right away you can see what you're allergic to. One of the cons to it is that you need to be off of any allergy medication for at least 2 weeks. And so if you're very allergic or suffering or miserable, that can be really hard on some people. And there are a couple of other medications commonly prescribed, like antidepressants, that also will impact the results of that. So you'd have to be off of those. And for some people, that's just a non-negotiable. And for those, that would be the blood testing. The blood testing is also nice because it includes foods. Prick testing does not include foods. The blood testing does. And some insurances, about a third of insurances cover it. All Medicare covers the blood testing. And about a third of other insurances cover it. Otherwise, if you pay cash, it's $295. Still not bad when you get an explanation of benefits back from when my daughter had hers. Our insurance would have paid $180, and the charge, though, was $3,700. So that's what they charge for this test that you pay $295. So that's a very expensive test for an inexpensive price here. Those are your two options. A lot of people are going with the blood testing because they're very curious as to the foods. It's very convenient. It's just a quick prick. You don't have to sit there, but there's a place for both. And so it's nice to have the option. So we do customized treatment here. As I just mentioned, Keith is our master mixer, and we have purchased all the extracts. So we have like a whole allergy clinic in this clinic. And we're able to mix customized trays with your customized allergens that we're going to slowly acclimate you to. And again, there's options there. You can have options to how you receive this treatment. One of them is called sublingual or slit, and one is called subcutaneous or skit. So slit and skit. Also, we just call them drops or shots. So the slit or the drops, you place them under your tongue. And just recently I was talking to another expert allergy clinic, and they said, you know what, just pull the lip out and drop it there. You don't need to worry about getting it way back there. And some people are having a hard time seeing in the mirror. So just pull the lip out, the buccal mucosa here. It's got plenty of those cells. So pull your lip out and just drop it right in. And so that's nice. You place the drops under your tongue. The subcutaneous are administered in the fat. So you just kind of grab your leg, your thigh, and just stick it right in. And you can do that. If you really cannot give yourself a shot, we're happy to help you here. But most people have no problem once we just give them a little encouragement and training doing that at home. And the convenience of being able to do that at home is great. They're both very safe. They're both very effective. Slit or the sublingual is considered a little safer in littles, like 3 years old. And then the subcutaneous or the shots, generally considered safe in 5 years old and up. Another kind of pros and cons of each. When you use the shots, there are less allergens that we're able to put in each vial. So you may need more shots, more vials of shots. We're actually able to put more allergens in the drops. So for example, my daughter, I'll use her as an example. She's got 2 vials and she's got, I don't remember, Keith, how many allergens she has, but she had a lot. And we were able to get it into 2 vials. So she's just got to do a drop of each. Whereas if she were to do shots, she would have had to do at least 3. So, there's the pros and the cons. But then she's doing those drops every single day. Whereas, can I use you? Dr. Morgan, he's once a week, and he's just one and done. Once a week. And how convenient is that? If he's got to travel, he doesn't have to bring it with him unless it's more than a week. So there are pros and cons to both. Another couple of things. You reach maintenance quicker with drops. The shots are a little bit more, you need to really keep them sterile. You need to keep them refrigerated. You need to be a little bit more careful with them. And the drops, you can keep them cool and dry. If they aren't in refrigerator, it's not a huge deal. So we go over all of that with you. You come in, you kind of get the counseling with us. You figure out what you're going to do for your testing and what you're going to do for your treatment. It's customized. You walk out of here, you know exactly what you're doing, and you feel very comfortable doing it. All right. So again, proven safe, effective. They gradually desensitize the immune system, like Dr. Morgan said. The neat thing, that middle one, it reduces your allergic system symptoms, and it may prevent new allergies from developing. So as we get older, I've had people come in recently, I never had an allergy to this thing until, I'm 50 years old, and all of a sudden I'm allergic to this. Well, that doesn't have to happen. So if we can decrease your total load, which I'll show you a little analogy of in a minute, you may not develop these new allergies out of seemingly nowhere. Consistent treatment, long-term benefits, like you said, 30 years. Usually you're going to get some relief at about 3 months. The rule of thumb is kind of a year to see some definite, give it the year. We want to give it a shot. No pun intended, and see that you really gave it a chance for a year. And that's considered like, a full year's treatment. You should see some benefit after a year. If you're not seeing anything after a year, you may want to see if this is for you. But some people have to do it up to 3 years to get that full benefit. So we'll have that conversation at that point. So even if you're not a member, you're not a member here, or are you? Not to single you out, but it's Ralph and you're not. So if you're not a member, you're supposed to get a free. I just end up giving everybody one because I made a bunch of them. But members, they're going to get perks because you're a member of Balance Health. I mean, you have a monthly membership fee, and so we are going to get everything at a very marked discount as a member. So to be fair, you're paying about half price as a member. If you need 1 to 2 vials, it's $50 a month. If you need 2 or more, it's $100 a month as a member. As a non-member, If you need 1 to 2 vials, it's $97, and we gave a little bit of a break for 2 or more vials at $177 per month. Now, if you add that to the $136 per person membership fee or $250 per couple membership fee, some people just find it makes more sense to be a member and get the lower price, unless you absolutely are not going to use the clinic for anything else, have a physician that you absolutely love and only want to do allergy treatment here. That's fine. I'll take care of you. But otherwise, your other providers here will just go ahead and take care of you, and you'll have the member pricing. So you have options there, but everybody has access. And other places, you can pay $3,000, even $4,000 a year for this. And I remember that's why when I was her age, I got 1 year. My parents were like, we can't afford this anymore. So after the year, I never did get the full treatment. But even that year, I got so much better. So I'm glad they at least were able to do the year. If you do 1 year up front, you're going to get a discount. So the $50 a month, if you have 1 to 2 vials, it turns out to be $550 if you pay for the year up front as a member. If you pay $100 a month, you pay $1,200 by the time the year is done. But if you pay the year up front, we give you 1 month free. It's $1,100 up front. So for all members, non-members, you get a free month if you pay for the year up front. And we do ask that you commit to the year, because when we mix and Keith mixes your treatment, we have to mix a full year's tray for you. So we can't just use that on somebody else. So we ask that you commit to that year. All right. So the benefits of treating environmental allergies for food, like I was mentioning before, is the cross-sensitivity concept. So just like I said before, looking at weeds, trees, and grasses, you can start to reduce the symptoms of your food because of that cross-reactivity. And people have a better quality of life because they're like, I'm no longer having a problem with this food, but I didn't stop eating the food. Of course, when we get the food results back and you see that you have this huge, this is what it looks like when you're really allergic to something. You see that? Can everybody see that red line? Okay, that means that most of her allergy is this thing. And in this case, it's cat dander. But it can look like that on a food for milk. So if your milk looks like that, should you drink milk every day? Probably not. However, if we treat you for mugwort, you'll probably tolerate the milk better. So we're not going to tell you to go out and, drink and eat everything that you're really allergic to, but we can reduce the total load with the treatment for the other things. So this is an actual picture of our allergy team at work. That's Haley, I think, and Joelle is our model. And that's prick testing. So instead of the individual prick, that I don't know if anybody's had prick testing with the 1, 2, they do 1 at a time. And it's like, oh, you're torturing me. So these are nice because we're doing 6 at a time and 12 at a time. We're doing 12, but chop, 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 chop. So we do little 12 each. So you're just going to, and you barely feel it. Not that I've had it, but this is what I heard. It doesn't hurt. Most of the discomfort is the itching, but after 15 to 20 minutes, we'll rub you down with some Benadryl cream and you'll be fine. But the obvious reasons, sneezing, having the runny nose, the dry eyes or the watery eyes, there's benefits beyond that. And Dr. Morgan alluded to that. There's a lot of people that assume they don't need treatment or testing because I don't have allergies. I'm not sneezing and coughing all the time. But if you can reduce your overall inflammation, which allergies produce inflammation, you can have these benefits that are listed here. Fewer colds, fewer illnesses, because you have a lower immune burden. Like he said, if your whole immune system is sequestered over here to try and fight these allergies that are just these mailmen, then here comes the wolf, the real harmful pathogen, and your immune system is busy, tied up over here, fighting this harmless allergy. So if we can get it to come away from there now, we can free them up to help you stay healthy over here with less illnesses during the year. Improved weight management. When you find out what foods you're allergic to, when you're not reacting to those foods, you don't hold on to so much inflammation, and you can actually drop and shed some extra weight because of that. And then easier management of chronic inflammatory conditions, for obvious reasons, like diabetes, prediabetes, cardiac issues, autoimmune issues. They're all systemic inflammation. If we can take down the inflammation, those issues can also get better. So again, you don't need to have horrible allergies to benefit from this. You need to understand your allergic load. And so we use this analogy of the cup. And so your immune system is kind of like, the burden is like a cup that's filled all the way to the very, very brim. And it looks like it should spill, but it doesn't spill. But you add one drop and the whole thing spills over. And the spillage is the symptoms. You were right there. And that's over the years. I wasn't allergic. I was fine. And now all of a sudden I'm allergic to everything. Well, it was building up all that time, and that one straw that broke the camel's back, there's your symptoms. What if we could get that glass to be half full? You're not going to have the overage, the spillage, which equals the symptoms. And that's what we achieve with the treatment. So that is it in a nutshell. Specifically, I wanted to mention asthma because the NIH recommends that the National Institute of Health, anyone that has asthma should be tested for allergies and potentially treated, because this will decrease their asthma need for medication, their asthma flare-ups, and improve their all over allergic inflammation, which goes hand in hand with asthma. So that's a recommendation. If you have asthma, if your kid has asthma, they need allergy testing. Thank you.